Hello everyone, I hope you are enjoying the virtual retreat so far. So this presentation will discuss tips and tricks on how to give a stroke presentation depending on who your communities are, and of course remembering what our topics will always be. I have no financial relationships to disclose at this time. So what are we talking about? We are talking about giving a presentation, a PowerPoint presentation. So tips and tricks. Connect with your audience. You always want to make sure that you are connecting with your audience. They understand what you are saying and they are leaving the conversation with a better understanding about stroke than what they came with. Let your passion shine through for the subject. And so we all work with stroke. We see the before and after effects of stroke, and we can really explain why it's important to know the signs and symptoms of stroke and why it's important to call 911 to get help. Be honest with your audience about why stroke is important to you and why it matters. It affects all of our communities. It affects all of us in one way or another. So be very honest and clear with why stroke is important to know about. And be enthusiastic with your audience, and they will respond. Have your enthusiasm in place, they will bring theirs. So who is your audience? Your audience is anyone in your community that you are targeting. So your target audience can include K through 12 students where you're going to the school talking to them, college students, adults in the workplace or on work sites. They can also include seniors in skilled nursing facilities or rehab facilities. Our audiences can be anyone and everyone because everyone has some relationship and some effects from stroke. The goal of the stroke program is to have one BFAST magnet on every refrigerator in the state of Arkansas. This is a hefty goal, but with all of us doing the work, we can get one of these magnets on every refrigerator. What is our message? Never forget, our message is stroke. We are talking about stroke, signs and symptoms, how to reduce the risk for stroke, and of course, how to seek stroke treatment. Make it easy for your audience to understand and to respond. We don't want to use very difficult words for them. We don't want to use nursing words for them that you learned in nursing school, but we want to give them regular, normal words explaining stroke and the signs and symptoms of stroke. We must engage our audience. I'll say that again. We must engage our audience and keep them engaged. It's very important to keep your audience engaged. You don't want to lose them. As you see on the slide here, it says, time is money. Money is power. Power is pizza. Pizza is knowledge. Let's go. They've got somewhere to be. They got a pizza party waiting. So you want to make sure you have them so engaged that they forget all about that pizza party and they are there tuned in and listening to what you have to say. What does your target audience need to know? Of course, there is a lot of things that we could tell them, a lot of information that we could share with them. You guys are nurses. We know you're smart. But what does your audience need to know? What do they need from you right now? They need to know what's important to them and how it affects their community. So all communities are different. K through 12 students, they need to know mostly how to recognize the signs and symptoms of a stroke and how to seek help, to get help for mom or grandma, granddad, grandparents that are possibly having a stroke. So make it easy for them to understand and only tell them what they need to know. Do not flood your audience. Less is more. As you see there, Obama said what he had to say, he dropped the mic, and he walked off stage. Do not flood your audience. Only tell them what they need to know: stroke, signs and symptoms, risk factors, and how to seek treatment. Let's not get into all the data around stroke if that's not the audience that needs that information, because that will kind of scare them away and they will lose the information that they need to stick with, which is signs and symptoms and how to treat a stroke. Remember, after educating your audience and after giving your wonderful presentation, you want to always promote your hospital. Promote yourself. We don't mean to brag, but if the shoe fits, talk about your hospital, your resources, and that your hospital is stroke ready and can treat a stroke any day, anytime. As long as they come there or call 911, you'll be there to take care of them. Always include your hospital capabilities and what services you offer for your community. You want to make sure that everything ends with, we are here in the community, we support the community, and we are providing resources to our community. In summary, determine your target audience, tailor your presentation to what the community needs to know, do not flood them, and remember to promote your hospital. Do I have any questions, anyone? That is the end of this presentation. Thank you so much.